I'm here to sort of talk a little bit about the Chaplaincy Innovation Labs and share the resources, all of which are available for free on the lab's website here. I brought some stickers and some buttons. I'll get this out afterwards and leave them for you all to take. But then I mostly wanted to talk about a project that we've been working on, looking at the supply of chaplaincy and spiritual care and demand or need for chaplaincy and spiritual care on the ground. And I'm going to walk through a slide deck. I'm a sociologist. I apologize for too much data, but I'll tell you some stories as we go. I want to talk through a slide deck that has been about 2.5 years of work. And it started from a question, which is that chaplains and spiritual care providers spend a lot of time thinking about how they should be trained and certified and what the institutions are that support them. I call this the supply side. I think it's necessary and important. It also drives me crazy. Because if all we're doing is talking about ourselves and how to care for the work, but we actually don't know how the work is received, where there's a need for the work, what clients or constituents have to say about the work, from my perspective, we're doing it backwards. So I want to build what I call a demand side approach to spiritual care that starts from the needs or opportunities that people have on the ground and works backward to prepare people to meet those needs. And I think that when we change the question and we look at it that way, we actually see things in fundamentally different ways. They threaten a lot of people, and I'll just put that out from the beginning, because they question much of the ways that things have always been. And I don't think that's bad, but I want to sort of just talk with you through the argument. There's way more information that you could never want to review in working papers and things, so I'll make sure you know where they are if you want to follow up with them afterwards. So I just downloaded our slide deck here. Okay. That's not it. Go away. There it is. Okay. So we started about 2 years ago with support from the Templeton Religion Trust, asking these questions. What is the demand for chaplains' life amongst the U.S. public? How are chaplains being trained to meet this demand? Where are the gaps? And what strategy can we develop to address these gaps and to ensure that chaplains and spiritual care providers are meeting people's needs? We actually have answers now to all 4 of these questions, and these are the answers that I'm going to share with you. The first is that we spent, oh my goodness, sorry, it's not my computer and I feel like I'm driving somebody else's car. Here we go. We spent about a year first mapping what we call the supply side. I already mentioned that. But we looked at all of the theological schools that offer degree programs with chaplaincy or spiritual care. We mapped their curriculum. I can show you what that looks like. We looked at learning objectives and competencies from the clinical training organizations. We talked to endorsers who are silent gatekeepers, which we can also talk more about. And then we interviewed employers and sector trainers, because many sectors, the military, the federal prisons, I don't want to say they retrain people when they arrive in the jobs, but there's a gap between how people arrive and what they need to do on their first day of work, and so we talked to them. So we have a sort of working paper about the supply side. And then in March of 2022, we worked with Gallup and we did the first national survey of the American public to try to figure out what fraction of the public has had contact with a chaplain. Where, why, to what ends. We also then interviewed 50 people who said that they had contact with chaplains. So we've got a working paper on supply and a working paper on demand. I'm going to give you the highlights. All right, so what do we know about demand? On my good days, I'll tell you that people in the United States have an expansive sense of chaplains. On my bad days, I'll tell you that nobody in the United States knows what a chaplain is. Today must be a bad day because I'm actually leaning towards the latter more than the former. So in the survey, we said the next set of questions are about chaplains. Now you all can pick this definition apart, just bear with me, we're working with survey researchers. The next set of questions are about chaplains. Religious professionals that you might meet outside of a congregation, like in healthcare, higher education, the military. Based on that definition, 44% of respondents told us that they had met a chaplain. We were shocked, 44%. So the next question was, where did you meet the chaplain? The largest number of people met the chaplain at church. And then we thought, well, chaplains go to church, so maybe they know someone in their congregation who does the work of chaplaincy or spiritual care. And so we did these follow-up interviews. That was the case. That was the case in 0% of the people that we interviewed. So once we sort of analyzed through the data to sort of get down to the fraction of people that has seen a chaplain by that definition I just described, it's about 18%. So what we say here is between 18 and 44% of the public report interacting with the chaplain based on their understandings of the chaplain. But those understandings are very broad and very diffuse. And that is a huge, huge marketing challenge. We can't be doing the work if people don't know who we are, what the work is. Once we sort of filter it down to the 18%, the most interesting finding is that there are almost no patterns. So we know in American religious life that women tend to be more religious. There are variations by race and gender and other factors. There are no variations when you get down to that 18% of people who has seen a chaplain, which I think is a good thing. It actually allows us to make the argument that chaplaincy is for everyone. There are a few patterns in those that are accessing chaplains. 2/3 of them are doing so through healthcare organizations. So that's the other kind of big finding. Not a surprise, but about 54% healthcare organizations, 14% palliative care, and then you can see a little bit of the distribution to the right. We also, in the interview, in the survey, asked people, were you the primary care recipient or were you a caregiver? It's about half and half. And part of what's interesting is that I actually don't think that chaplains have a clear kind of strategy about when they serve the patient versus when they serve the family. And I would actually argue that chaplains don't really have a business model. So in the military, the chaplains spend most of their time with members of the military. They see themselves as force multipliers. If you take that thinking and you apply it to healthcare, healthcare chaplains should spend most of their time with staff. They did during COVID, but that's not the way that most chaplains or most healthcare systems speak about chaplains. We actually did a project I could talk more about where we interviewed healthcare executives before the pandemic, and about half of them know what chaplains are, the other half really don't have a clue. But the half who know what chaplains are talk about them in relation to staff, which is interesting. So I'm raising some questions here, right? What is a chaplain and how do we deal with kind of challenges around the fact that people aren't sure? If healthcare is the main place that people are accessing chaplains, that's an interesting entry point that could lead strategically to many other places, but we haven't thought about it that way. And then who are the people chaplains are serving? We see that they're demographically very vast, but we need to think about recipients of care versus caregivers and think a little bit about business model. We then asked about sort of what the issues are around which people work, and not surprisingly, it's a lot of work around loss, death, and dying, both traditionally religious support, and I always say most of what chaplains do doesn't look, quote, religious in any traditional way. All right, so if we start with the demand, this is what we see. Then what do we know about supply if we back up to how chaplains are trained? I'm going to do a little bit quickly here because this is, I think, sort of probably more well-known. But it's organizationally complicated. There's a gazillion organizations that they get along, they don't get along, they talk to each other, they don't talk to each other. There really aren't clear guidelines or paths for what the skills are. So Shelley Rambo and I worked with a whole group of both theological and clinical educators a few years ago. And we wrote a book that UNC Press published. We call it the textbook. And when we gathered this group and we got the funding to do this, we actually thought we were going to be able to shift theological school curriculum because there's very little commonality in what theological schools are teaching chaplains. Once we got the group together, we realized that just politically that wasn't going to work. We don't have the authority to shift curriculum. So we thought, let's go in the back door. Let's build materials. Because if we can get everybody using the same textbook, we're at least headed in the right direction. So in this textbook, we named 3 competencies that we think all chaplains need to have. We call them interpersonal, organizational, and meaning-making. So what does that mean? Organizational is about, interpersonal is about interpersonal dynamics, right? Counseling, therapy, engagement at the one-on-one level. Most chaplains are very good at that. It's because of this interest that most people go into chaplaincy. Meaning-making is a general word that we're using to describe theological, right? This is sort of what I would argue chaplain's special sauce is. It's thinking about questions of meaning and purpose across all of the ways that people answer those questions. It's a big piece, in my view, of what makes chaplains distinct from social workers and others. The piece that most chaplains either aren't that interested in, overlook, or just don't care that much about is the organizational dimension, which is being able to navigate in an organization, understand complex organizations, think about organizational change, And I would argue that to be effective, because chaplains are so few in the organization in which they work, we have to do a lot more thinking and work around the organizational needs. So this is not part of what we found on the supply side, but it is part of what we're trying to kind of encourage people to think about. And I should have brought one of those books. I'm sorry I didn't, but I'm happy to make one available. There's not a lot of standardization, as I mentioned, in coursework. I can show you the tables. And when we interviewed the employers were actually quite clear that there are 3 things that chaplains need to know that they don't come into the work knowing. They need to know more about responding to crisis and crisis intervention. They need more experience around working in moral injury. And they need more experience working across pluralistic and increasingly non-religious workplaces. So these 3 things are the 3 kind of big take-home messages on the supply side: crisis intervention, moral injury, and the work of religious diversity and pluralism, including those who are not religiously affiliated, which as of the report last week is 28%. All right, so then what are the gaps between supply and demand? What is the take-home message here? The public, we think, has limited and inconsistent knowledge of who chaplains are. The business model is based on service provision through organizations that are focused on other things, right? Healthcare organizations, military, prisons. Part of what I'm so interested to learn more about here in Maine is this direct-to-consumer model. Opportunities to serve people and their caregivers distinctly might not be fully realized. On the supply side, there's not a well-coordinated network in terms of how people are trained. And the educators and the employers are not regularly in conversation. So I imagine that 50 years ago in the big steeple churches, the CPE educators and some of the head leaders of the local healthcare organization and the seminary professor were probably sitting in the same pews, and they could talk at coffee hour. They knew each other. That's not the case anymore. And so there actually is no consistent place where the employers and the educators are gathering to sort of figure out how to refresh materials, what's needed, what's happening. And then the endorsers are complicated. I mean, I have a chart I can show you. You need to be endorsed to work in a set of federal jobs. And there are a set of endorsers, but it's as clear as mud what a group does if they want to become an endorser. And my worry is that these endorsers are systematically excluding the very people we need to be bringing in to the work of chaplaincy and spiritual care, especially in the military, where so many young people are not religiously affiliated. The military doesn't allow humanists, atheists, agnostic chaplains. There have been various court battles about it. We're working with the Army. They're interested in thinking a little more generally. But I really worry about the, and you'll forgive me for this, old boys network that really is how the endorsers have and continue to work. All right, so what do we do about this? What's the next step? Well, these are the questions about, do these things sort of, resonate with you? Do they seem like the right kinds of questions? We sort of talked about these findings with a whole range of people, and then we developed a strategic approach, which I'm going to go to in a second. But before we go there, just to sort of name some of all the stakeholders that are trying to do the training, we made this picture that kind of helps to think about the supply side map, right? Kind of all the different boxes or people or organization that one goes through to be trained. And then this is on the website, so you can look at it in more detail. But we have what I think are very interesting findings. This is about what people were engaged with. This is a table about what you need to be trained in to work in all these different places. The place I'm going to is the last one, this. So this is when you look at degree programs that have chaplaincy or spiritual care in the title across the United States, and you look for commonalities in them. The ones that are the most common are around 50%, and it's about CPE, pastoral counseling, ethics, and a sacred language. We have a joke in our office, which doesn't exist because we're all virtual, about how we're still waiting to meet the client who says they wish that their chaplain spoke better ancient Greek or Hebrew. 56%, right? But then as you go down, there's just not a lot of consistency. All right, so from this approach, and from the gap analysis, we then built a strategic vision. Here it is. We just released it a little while ago. The group of workmates made us this cool video, which is fun to watch. But what is this vision? So what we want to do is begin to advocate for an approach to spiritual care that's less about the people doing the work and more about the work that needs to be done, and works from the demand side back. And we're thinking about how to begin to think about chaplains and spiritual care providers, who I would argue have always had a different delivery mechanism, right? So in the United States, the most traditional common delivery mechanism for spiritual and religious content is the congregation, right? That's mostly what we have done. There are all kinds of arguments out there about new immigrant groups and others. When they come to the United States, they develop a congregational form. There's nothing wrong with any of this, except the congregations are closing. And we've been mapping in Greater Boston for the last year the number of congregations that have closed since the year 2000. We're trying to build a methodology. We found 225 congregations. And we built them into a database. We're pulling the deeds to see what happens to the churches. But the sort of most traditional delivery mechanism is changing. And so that's sort of the one side. At the same time, there are lots of innovators, spiritual innovators, religious innovators, trying things in different ways. And we need to learn more about them. We're actually about to start a project mapping them. So what I think is going on here, people will tell you the United States is secularizing. Yeah, maybe. I actually think what's happening is that the delivery system doesn't work anymore, or as well, it doesn't resonate with people. I'll say none of us go to Blockbuster anymore to watch movies, but we all still watch movies, right? So what's the Netflix equivalent for spiritual care and chaplaincy? That's the question. What's the business model? And what's the delivery system? And how do we build it? Because part of the challenge is that it takes money, and there's almost no money in this area. And how do you repurpose the money from the old and build something new? So I have called many a seminary president when their seminaries are closing and made the case, they've also know, they think I'm crazy, but I make the case that particularly for mainline Protestant traditions, chaplains are their legacy. And I can show you in Greater Boston in a lot of detail how the hospitals that have the strongest CPE programs, have endowed funds, were all built mostly by Congregationalists and Episcopalians because we're in Boston, but I think we can actually look at that across the country. So how do you repurpose the old and make it work in the new? And this is part of what I think you all are figuring out here in Maine, and the challenge, which is getting funding for it, is working here at the moment, right? And I say we get a call probably once a month to the lab from somebody who wants to build 1-800 dial a chaplain, and with very few exceptions, it doesn't work. People haven't figured out how to resource it, right? It's the money question. And so I'm just really excited to be here with you in this conversation, thinking about how to do this work. And as we begin to try to work on this kind of approach, what we want to do, here's this one paragraph right here, this is the vision. We want to ground what we're doing in the work of chaplaincy and spiritual care instead of just the people. And we want to start from those who can benefit. And so, if we could wave our magic wand, and I'm trying to raise money for a foundation that how to do this, this is what we want. I want everyone in the United States to have access to spiritual care. I want them to know what it is, and they can say no. I don't care if they say no, but I want them to know what it is and how or why to access it and why it might help them. Even the people that we interviewed who had met with the chaplain didn't know why they might do so again. That's a problem, right? So we're trying to figure out how to build the knowledge amongst the public about what chaplaincy and spiritual care is. I think we need to think about it in its traditional settings. Sometimes we call them the legacy settings, right? Healthcare, the military, and prisons. That's probably not going to change. When you interview people in any federal position, they talk about their job being to protect the free exercise, right? And so the military folks talk about free exercise. The healthcare people talk about kind of spiritual care and interpersonal engagement, so they're very different frames. But how do we continue to support what's happening in legacy institutions and think about them as an avenue that could lead people in other places? I have a vision that only I can see in Greater Boston because I've talked to so many chaplains there, where when you go into a hospital and you're discharged to rehab, there's a spiritual care handoff. And then when you go back to your community, there's a discharge to your community spiritual care person who might work in a CDS, right? It's not that we need to create these positions anew. There are places where you could always already connect in. Or when you go back to a nursing facility, there's a spiritual care handoff. We're far from that, but that's what I'd like to imagine. And that requires new business models that enable doing this work in new settings and that kind of can support both the legacy and the new. And then we've got to find some way to continue to address and make the system work, right? You've got to have the recipients talking to the educators, and it's got to go around in a circle, because otherwise people are just kind of in their own corners when you keep doing things the ways they've always done them. And it's just very hard to make change. So this is a big picture. There's a lot more here that you're welcome to look at or take a peek at the video. It has a lot of chapters. This is my newest book, and I'll leave it with the stickers and stuff, which I'm happy to talk about. But when I did, all of the lab grew out of my trying to write this book. So in 2016, 2017, I was interviewing the leaders of chaplaincy organizations across the country. So I talked to the airport folks and the ports and the military, anybody I could find. And what was so interesting to me is that they were all telling me the same things. They all had the same problems, but they didn't know each other. Most people are patient. They do the work, and then they kind of try to do the impact. I'm not very patient. So I had met Michael Skaggs, who many of you have heard on webinars. Michael Skaggs was finishing a history PhD at Notre Dame, and he was working on the side for the North American Maritime Ministry Association, which is the port chaplaincy group, and he had come to a meeting that they hold once a year with a lot of maritime bigwig people and a lot of champagne in Connecticut. So I had gone to the meeting, and Michael and I met there, and we just started talking, and I'm like, well, what if we just build a website and see if we can get anybody to come? How do we bring these people that I'm meeting that don't know each other into a common conversation? And it was with $20,000 and Michael's ability to figure out anything that we launched the website for the lab. And it was really to kind of enlarge the conversation, bring people in, try to take down some of the silos. And the work that we've done since that time has really grown from that point. So I like to say that my book, which was not about the national people, but then was about the city of Boston. So I thought, what would happen? What I wanted to do was a project about the military. But my kids were like 1 and 4, and that just wasn't happening. There are no military bases in Great Boston. So I thought, what if I just go around and look for chaplains, which is what I did. Ended up interviewing 65 chaplains in a whole wide range of organizations. People who think about spiritual care usually think about only one place, healthcare or higher ed. And I thought, well, these people are part of the ecosystem right here in Boston. And what if I try to map and understand that? And I also went to archives and asked archivists to help me. And I learned that, the Boston Fire Department had its first chaplain in 1906. And there's all kinds of histories. Long Island, where most recently there were many people who were unhoused, had a hospital, and they had a whole community that had been built by the chaplain, and I've got all their newsletters. I mean, there's a whole rich history of chaplaincy and spiritual care that really hasn't been written. And the people in all these settings are doing much of the same work. And so the book is about them. And at the center of it are a couple of arguments. One is the argument that there are only 2 things that I have found that all chaplains do. One is they help people remember their peripheral vision, kind of pick up their heads in moments of crisis and trauma and loss, and remember or try to remember or try to sort of see the things that they care about more generally. And the other is to work around death and loss. That one's not a surprise. The ways that they do so are different. Their embeddedness in organizations are different. There's a lot more that I could say here. But the book is the justification for the lab. The lab has been an effort to bring people together so that we can collectively do good in the world. And I'm convinced that moving forward, that has to be kind of based in need. And increasingly, I think the word isn't demand. Because I don't think that anybody is demanding a chaplain. People don't know who they are. But I think that we can see that there's enormous need. And the Surgeon General's most recent report about social isolation is very clear about how the decline of traditional congregations has contributed to people being more isolated with many other factors. But there's no vision in that document for what the role is of religious professionals going forward. And I think that that's the opportunity here. I can go on, but I'm going to stop here and see if any of this resonates with you, if there are things you want to talk about now, or if we would talk later. I'm not sure, Lori, how you want to proceed, but I'm happy to follow.